Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Chances are sometime in your life you've had an earache or a sore throat or both, and both can be quite irritating, even painful, and if not taken care of, they can lead to something much more serious. Joining us in studio now to tell us more about the symptoms and ways to treat earaches as well as sore throats is Express Care's Dr. Jitka Lom. Thanks, Doc, so much for coming in.
Sure.
Now tell us, what causes earaches?
Okay, well, the ear is divided into sort of three sections. You have the outer ear canal, which can get infected with bacteria. That's commonly known as swimmer's ear. A little bit of water gets in there, it gets dirty, and becomes painful. Then we have the middle ear, which is behind the eardrum. That is a small space, and it can accumulate fluid and pressure, and again, be infected with bacteria or viruses and become painful. And then we have the very inner part of the ear, which is basically a collection of nerves, and those nerves can also become painful, inflamed because of various diseases. So we have different reasons for earaches, and that's why when you have one, you probably need to be checked.
Now, you mentioned briefly, but what is swimmer's ear and how do you get it? I mean, is it just whenever you go swimming or when you, I guess, submerge underwater?
Right. So swimmer's ear is actually a skin infection. What you see on the outside here is cartilage and skin, and then that travels inside like a little tube. That tube is also covered with skin, and the skin can become infected. And that happens when a little bit of water stays in there too long, or it's dirty water from either swimming in a dirty environment, or the water just sitting around too long in there. So after you swim, it's a good idea to get out of the water, shake out your ear, dry it, and you can also use either hydrogen peroxide or a little bit of alcohol to clean out the ear and prevent water from sitting around in there.
Now, what are some of the symptoms of an earache aside from, maybe some tingling or ringing in your ear, things like that?
Well, earaches can be certainly very painful and can go along with fever as well, especially in young children. Mm-hmm. Earaches can be very painful, cause a little bit of nausea or even vomiting. In very young children, they can actually lead to dehydration because there's so much pain the child doesn't want to drink. As you know, when you swallow, the swallowing mechanism will also trigger some sensation in your ear, pressure differences, and you may suffer pain.
Okay. Now, how do you know if your earache is from a cold or if it's from an ear infection?
Right. Actually, most ear infections are caused by viruses, over 80%. So when your young child has a low-grade fever and an earache, it's okay to watch it and give your child Tylenol and just monitor. On the other hand, if the fever is very high, or if there's actually drainage coming out of the ear, then it's usually a bacterial infection and antibiotics are required.
Okay. Can an ear infection only be cured with antibiotics?
No, as I was mentioning, if it's a viral infection, just time will take care of it. Your body will heal it. If there's, again, a high fever or drainage, then usually antibiotics will be more appropriate.
Okay, now what happens if you leave it untreated?
Well, as I mentioned, in the middle ear space, that's a fixed space. There's just a very small amount of fluid that can accumulate there without too much pressure. If there's too much pressure, you will rupture your eardrum. You get a hole in it and have bloody drainage coming out, incredibly painful. And in addition, if that's left even longer, which I've seen a few times, where the infection continues and continues, it can actually erode into the bone, create massive infections, even abscesses and pus deep inside, requiring surgery and so on. So you want to avoid those kind of complications and just deal with your earache when it's a minor earache.
Absolutely. So what happens, how do you know the difference of, okay, this is just a viral thing, time will take its course, or I need to go to the doctor and see the doctor?
I think the level of pain that the person's experiencing, if you can control it with Tylenol, the fever, same thing. Child is behaving normally, drinking and eating normally, then that's all okay. And if any of that's not happening, or especially if there's vomiting or dehydration, then your child needs to get seen. And one other thing I would mention is that there's a funny reflex from your inner ear, your middle ear. If you tickle your eardrum, it'll make you cough. So when you have a ear infection, you may also have a cough along with that. So quite oftentimes people will come in with their child and say, my child is coughing. We'll listen to the chest, it'll be completely clear, but they will have an ear infection, and that was the only sign of it, their cough.
Interesting.
Yeah.
Okay, good to know, now I know. What is a sore throat and what causes it?
Okay, well, the back of the throat involves many pieces of your anatomy. You have the soft palate, the hard palate, your tonsils, your adenoids, your tongue, and then you have your glands in here, your thyroid, and some nerves that connect up to your ears. So there are many, many things there that can become irritated and painful. Mm-hmm. The most common thing, of course, we all know is a sore throat, is a strep throat or a viral sore throat, where basically the soft palate in the very back of the throat, when you look back there and you see the little uvula hanging down, all of that's very red and inflamed, and it hurts to swallow, and you may have a fever with it. Other times there might be little blisters back there, or pus on your tonsils, or again, even sometimes an abscess, meaning a pus collection right in your tonsil. And one other thing that can give you a sore throat is a bad tooth, if you have a serious abscess in your tooth.
Interesting.
Yeah.
Okay. Now, are earaches and sore throats, can they be linked, or are they linked?
They can be linked, especially if you have a viral illness, meaning like a cold in your throat. You have a cold there and maybe a little bit of a runny nose, and you have a little bit of pain. And in the same way, you may have some fluid accumulating in your middle ear, and that gives you pressure there and pain.
Okay, now what are the different types of throat infections? You mentioned a little bit about them, but I think I've heard of mono, laryngitis, things like that.
Sure. So laryngitis is actually a vocal cord inflammation where you become hoarse or can't speak at all, whispering only, but without any pain. And that's a completely viral illness. It will go away entirely by itself in about a week. Then you have viral sore throats. Those sometimes have blisters on the back of the throat, sometimes it's just red, but there's usually no fever or very low-grade fever, along with maybe a little bit of a runny nose or a slight cough. And then we have strep infections. Now, strep is the short form for the word streptococcus, and that is a very nasty bacteria. And it can cause a painful sore throat with redness, pus on the tonsils, and swollen glands. Now, if left alone, this strep infection can also affect your heart and cause something called rheumatic heart disease or rheumatic fever. In addition, it can settle on your kidneys and cause serious kidney infections, which can even lead on to very, very serious kidney damage. So it's important that strep infections be treated properly, and that's with antibiotics such as penicillin. And your last question was mononucleosis, or mono for short, or kissing disease in teenagers. Mono is a type of viral infection also. It's caused by a virus called the Epstein-Barr virus. Mm-hmm. And it's a very long-lasting sore throat. It can have, the person can have sore throat fever and very, very swollen glands, hugely swollen glands, and they're very tired. And that may last for several weeks, if not a few months, before they can recover.
So how do you treat these, real quickly?
Okay, so the bacterial strep infection, we can test for that with a swab and antibiotics. And for the other ones that are viral, we just let them run their course.
Why is it that they recommend gargling with warm salt water? What does that do?
Oh, that's a great question. You know, gargling helps us clean the back of the throat, as does brushing our teeth and just rinsing. Because when we have infections, we accumulate pus back there. That's the white stuff on your tonsils, just swelling and inflammation. And so when you gargle, you're basically rinsing and removing debris and dead tissue, and rinsing off, flushing out bacteria that shouldn't be there.
Okay, sounds good. Thanks, Doc. We will continue our discussion on earaches and sore throats when Healthy Living returns. Stay with us.